It is so nice to catch a glimpse of the global picture. I'm Judy Woodruff of the PBS NewsHour, and it's my honor to be here along with Dr. David Kessler, who, of course, as you just heard, has been named to be the scientific advisor for the vaccine rollout, the COVID response on the part of the Biden administration. Dr. Kessler, very good to see you in this conversation we're going to have for the next 12 minutes. You were asked by the Biden team when the campaign was underway last year to advise them. And then once he was elected, you were asked to head up this effort from the science standpoint. Tell us where the vaccine distribution picture was when the president took office, and where is it right now?
So, my hat's off to my colleagues at what we used to call Operation Warp Speed for really doing just terrific science with our colleagues at the NIH and at a number of companies. And they focused on making sure that they had options. They invested in 6+ different vaccines. They didn't know which vaccines would turn out to work. So they bought 100 million of this, 100 million of that, 100 million of that. They invested in 300 million of AstraZeneca. But as it turned out, as we all now know, Pfizer and Moderna came in with really extraordinary results at 94, 95% efficacy. And so when we came in, right, I mean, there was not enough vaccine. There was not enough supply to be able to inject all adults over 18. So first order of business, first directive from the president was to acquire enough vaccine for all adults. And as the president announced 2 weeks ago, we had acquired 600 million doses of Moderna and Pfizer to have enough vaccine to immunize everyone by July 31st. So that was the first order of business. Second issue was while there was a plan to be able to ship these vaccines to the states, there was no plan to get these in arms. So we had to stand up. So obviously, with the good work of all state and local authorities, we had to be able to assist and bring all the federal resources to help in that effort.
And as you know, as all of us know, there have been some places have gotten the vaccine. What is it? Tens of millions of Americans do have the vaccine, but there's still many millions, hundreds of millions who don't have the vaccine yet. How are you? I mean, this is a program about the cities. How is the administration coordinating with states and cities, jurisdictions to make sure that the vaccine is getting to the places it needs to be as fast as possible?
So, we are working, I can tell you, day and night with our state and local health colleagues. I mean, if you look at where we were back in January, we were shipping about maybe 5 to 7 million doses a week. That has doubled by end of February, and certainly that will triple by early April. So we've had a supply issue. I think over time, over the next few months, that will shift. We will open up that supply. But when you look at just the numbers, 96 million doses distributed, 75 million administered to date, number of people receiving 1 or more doses, 50 million, number of people receiving 2 doses, 25 million. And that's just in a few weeks of us being here.
And how can the federal government, you and I have talked about this actually, Dr. Kessler, how much influence does the federal government have over local and state jurisdictions when it comes to making sure that the vaccine is distributed equitably?
Yeah. I don't think the right word is influence. I think there's a real partnership and working together. The state and local authorities are administering vaccines in a number of different settings. And we've added, with the state and local authorities, a number of settings to assure that the vaccine is administered equitably and equally. We've added mass vaccination sites. We've stood up these smaller, some close to 500 smaller vaccination sites. We're also making sure it's distributed now in pharmacies, in community health centers, in mobile centers. So we are adding a number of different distribution channels with our state and local partners to make sure that the vaccine gets to all Americans.
How much of a challenge is there? And again, it's something I know very much on your mind, the mind of the administration, to make sure that underserved populations who might have difficulty either with the online appointments or for some other reason may be reluctant to participate, to take the vaccine. How is the administration working on these issues?
You know, we stood up a number of distribution channels, really focused, in a central way on making sure that those who are most vulnerable, that their communities have access. We have to recognize this is, with the limited supply to date, this is a problem of access. But we also have to deal with the rightful question of hesitancy, and make sure that all people can trust the safety of the vaccine. And I've spent a lot of time, Judy, as you know, I ran FDA. Drug safety, vaccine safety is something I've studied for 30 or 40 years. And it's really, it's just extraordinary, one, to have 3 vaccines that have gotten authorization. And also, knock wood, everything I know about the safety profile, and I look at it very, very, very closely, these are, remarkably safe vaccines. And I think the public needs to understand that, and especially communities that have been rightfully distrustful of the medical establishment and government. I think they have to have confidence in this vaccine, and I think they can.
A question coming in, Dr. Kessler, from the director of the Mayor's Office of Performance and Innovation in Baltimore. His name is Dan Heimowitz. It actually plays off what you were just saying a moment ago. What advice do you have for cities for getting the most from their collaboration with federal and state governments for their vaccine rollouts, particularly with an eye toward ensuring that the vaccines reach the most vulnerable?
Mayor Bloomberg and I were talking a number of days ago, and what he remarked, and I think he's right on, was that, while we have a supply problem today, we will soon see that change with more and more vaccines, that doubling, that tripling of the amount of vaccines we ship every week. I think we're going to end up with adequate supply, but we're going to have to be able to make people comfortable that they're willing to take this. We're going to go from a supply problem to a demand problem. So that last mile, right, of really focusing on people's trust and transparency. I think it's very important. We're collecting a lot of data, and I think we need to share that data with the public, and certainly our state and local partners, to be able to share with us and the public who's actually getting vaccinated, to make sure that we can show that we're doing this equally and equitably. So being transparent with the public, making sure we maintain their trust. I think that's key here.
I want to broaden it out here as our time draws to a close, Dr. Kessler, to ask you frankly, an international question. As you know, the World Health Organization, the WHO, and others have said the rich countries are buying up all the available vaccines, the poorer countries around the world and their populations are having to wait to the back of the line. What responsibility does the United States have to make sure that the people who live in countries that are not the richest have their fair share of vaccines in a timely way?
We have a great deal of responsibility, not only to the United States, but globally. It's something the president cares very much about. That's why he talked about the pledge of $4 billion to the Global Alliance for Vaccine. But I think we need to think about it in a way that it's not us buying up vaccines. I mean, we have an enormous ability, especially in the United States, to make vaccines. We are a biomedical powerhouse. And what we need to think about is using our resources to be able to serve the world and use those resources, that biomedical powerhouse, to be able to make enough drug substance, fill finish, so we can make these vaccines as quickly available as possible around that world. We have enormous capability. No doubt, that great biomedical capability put us in a very enviable position of now having 3 vaccines that have had EUA authorization. But also with that comes a great deal of responsibility now to take all that knowledge and make it available to the world.
And a very quick final question. How long do you think it'll be before everyone in the world who wants to be vaccinated can be vaccinated?
That's a hard question, but I think we can, through the end of this year and into next year, I think we can have orders of magnitude of vaccine, certainly in the billions of doses available. It is a very tall order, but I think we can get there to make this, very important medicine, these vaccines available.
Dr. David Kessler, who, of course, former FDA commissioner, now the science advisor for the Biden administration vaccine rollout. Dr. Kessler, thank you so much.
My pleasure.
And now, absolutely. And now our next urgent conversation on city economies and rebuilding from COVID-19. Here is Lourdes German.